So one exercise I really like to show to help patients with hip mobility issues, hip pain, maybe they're having a lower back or pelvic pain and stuff like that, maybe SI joint pain, is to help improve their hip mobility. So what we like to do is get into this 90-90 position, and I've showed this before, but what we can do to help get some internal rotation, which is where the femur starts to go inward, right? A lot of people don't have that. So what I'll do is get into this 90-90 position. I'll grab at the edge of my own knee here. So let me turn a little bit. And what we'll do is we'll go into this type of position. Now, you could see me rock forward. You can place a little hand here and just kind of bump, but you can see that the hip is starting to rotate. Big mistake a lot of people do is they'll go and they'll try to pinch the hip, or they'll try to overly rotate inward. Just go through some gentle joint mobilization. Don't try to overdo it, and just kind of go back and forth. It's okay to rock forward, but what you're slowly starting to do is get this connective tissue that's deep within the hip capsule to start opening up and start to really get that internal rotation. You can hold it there, or you could just kind of do some ranges here. If you're a little more flexible, maybe you want to put your heel on your bicep. I probably wouldn't recommend that at the beginning, but definitely start to rock through that type of range and really get the hip to start moving. Then you could do it on the other side. So you get a little external on this side, a little internal on that side, and you can find out which one is there. And so this is a great way to get internal rotation of the hip, and try it on both sides. See where your deficits are and see where your mobility issues are.